When you enter the treatment page, you will be able to view all the answers that you have provided in the clinical examination. By tapping on the symbol on the left of the asterisk symbol on the top of the screen, you can choose to view the answers of a specific category. You can exit the treatment menu and take a shortcut to any other part of the program by tapping on the symbol on the left of the plus sign. By tapping on the plus sign, you can create a new treatment. In the new treatment, there are the methods of treatment. By tapping on the plus sign, you can choose whether you want to use the preset form or make a custom note. By tapping on the form, a table appears. You will be asked which asterisk signs you want to reassess. After you do this, they will appear in categories. You can then enter the technique, or you can select Other in the existing techniques and make a custom note. You can, for instance, select to perform a PA. You would then fill out the position. It is not mandatory to fill out everything. You can add body region, grade, rhythm. You can also enter the symptoms response to the technique. If, for instance, it appears in the beginning of the movement, if there is pain, resistance, or spasm, you can opt to draw a movement diagram. With the asterisk reassessment, you can note the outcome of the technique by assessing again the asterisks. By tapping on the blank space, you will see all the information summarized in one table. In this way, you can always be in control of what you have done in one treatment and what the response was. With a custom note option, you can enter any information you find relevant. For instance, the execution of a right unilateral PA on L5. Flexion was better on reassessment. The program will list the methods on the right. Similarly, you can note exercises either with the use of the form or a custom note. On the left of the screen, following the exercises, you will see the manipulation consent form. On the top of the consent form, there are recommended contraindications, and the therapist can inform the patient for the specific body region and obtain consent. By tapping on the return sign, the program will ask for confirmation to finalize the signature. Following the treatment documentation, you can choose to plan the next treatment. You can note what you would like to do in the physical examination, which asterisk signs from the subjective and physical examination to reassess, what treatment methods and/or exercises to use. By returning to the main menu of treatments, you can tap on the plus sign to create a second treatment. By entering that page, you can see on the right side of the screen the treatment plan that you have created in advance. You can also see the contraindications to treatment in red. On the left side, there is a question, "How are you today?" You can also make a custom note. Following this, you can reassess the asterisk signs of the subjective and physical examination and move on to the next treatment. To return to the main menu, tap on the return sign.